Yo, what's good, everybody? Today we're gonna be talking about meningioma. Um, it's one of the more commonly tested primary brain tumors on step one, and it's a pretty high yield topic because the NBME can give you like an image or even like a tumor location, and it's important for you to distinguish extra axial from intra-axial brain tumors. And hopefully by the end of the video you can really understand about more about meningioma. All right, so overview. um Meningiomas are extra axial brain tumors that arise from the meninges, and they are typically benign, and also slow growing, and um they can also grow outside of the brain tissue itself. So most or some of their symptoms come from the compression of adjacent brain structures rather than invasion of the brain parenchyma. Why does NBME like to test this? So, um, well, they like to test the anatomy behind it, and usually, well, I guess if you know meningiomas, you're gonna hope that they just give you an image, and so that you can possibly recognize an extra-axial mass and then correctly identify its cell of origin. And speaking of the cell of origin, meningiomas are from the arachnoid cap cells, which are part of the meninges. And I feel like you should definitely know that one out of anything I talk about. So meningiomas, where do they arise from? The arachnoid cap cells, which are part of the meninges. And because the tumor it originates from the meninges rather than the brain tissue, it grows along the surface of the brain instead of within the brain. Okay, and like I mentioned, meningiomas, they grow very slowly, and they are well circumcised. Okay, and they really rarely infiltrate brain tissue, but instead they just compress adjacent structures. And that's why most patients usually have um, progressive symptoms rather than like sudden deficits. And the symptoms of meningiomas are usually caused by the mass effect, and as the tumor gets bigger and bigger and bigger, it increases the intracranial pressure, and it compresses nearby brain tissue. And this can lead to headaches, seizures, and focal neurological deficits. And yeah, so like I mentioned, though these are like the common symptoms, and I don't think you're gonna answer any questions knowing these symptoms. To be honest, they're just so generalized. But um, I think what you should know is the location. So tumors along the cerebral convexities often can cause seizures, and parasagittal tumors can compress the motor cortex, which can cause weakness, especially in the lower extremities, so your legs. And tumors at the skull base may compress cranial nerves, which can obviously lead to cranial nerve deficits. And here is a great image of a meningioma. Um, yeah, look at that sucker. Look like a big scab on your brain. Um, yeah, meningiomas appear as extra axial, well circumcised masses, and they show homogeneous enhancement with contrast. And because they are outside the brain tissue, they look like they're pushing the brain inward rather than arising from it. And another important thing, the dural tail sign, it's an important feature of meningiomas, and it refers to the thickened enhancing dura adjacent to the tumor. And yeah, it's not like, it doesn't always mean that it's a meningioma, but usually if you see it, like think of the meningioma, okay? And then on CT, meningiomas are often hyperdense and may show calcifications. But then MRI obviously is like the best imaging modality, and it shows a well-defined enhancing mass with clear dural attachment. So I think it's kind of important to possibly know that, because if they give it to you on the exam, it can be a real clear indication that you're dealing with um, a meningioma. And so the primary treatment is surgical resection. And because they're so benign and well circumcised, like, it's usually a pretty successful outcome. The prognosis, it's a benign tumor, so it's fairly very good. And like I mentioned above, the surgeries are usually successful for it. Oops, don't get it confused with glioblastomas, which are intraaxial and infiltrative, and these are pretty bad. And if you have metastases to the brain, it's usually multiple and also intraaxial. And schwannomas, they arise from cranial nerves, especially nerve 8. And so if you just know that meningiomas are extraaxial in location, then it will definitely help you a lot. Like, usually, before we get to the question, usually the vignette will describe like a middle-aged woman with progressive headaches or seizures, and the imaging is probably the important thing, and it reveals a well-circumcised extra axial mass attached to the dura. And when you see this, you should probably think that it's the meningioma. But yeah, this is the sample question. Just read it and let me know what you think in 5, 4, 3, 2, 1. Okay, so let me just do the question with you. Which of the following is the most likely cell of origin of this neoplasm? So a 58-year-old woman presents with progressively worsening headaches and new onset focal seizures over the past 4 months. Neurologic examination reveals a mild weakness of the right lower extremity. MRI of the brain demonstrates a well-circumcised extra-axial mass along the parasagittal region with the compression of the adjacent cerebral cortex. The lesion shows homogeneous enhancement and appears attached to the dura. Okay, so I think from here, what really helps is probably the MRI. It says MRI of the brain demonstrates a well-circumcised extra-axial mass, so you can kind of already tell that it's referring to meningioma, right? And it's like a dural attachment, right? Attached to the dura. It's a homogeneous enhancement as well, and it's over the past 4 months. That means it's very progressive. It's like slow symptoms. And what else? Yeah, I feel like that's pretty good. And then remember that meningiomas arise from arachnoid cap cells, which are part of the meninges. And remember that they grow outside the brain tissue. Sorry, that's my dog feeder. But yeah, so the answer will be D, meningeal. And just the summary, just remember that just remember like these 4 things. I feel like these are like definitely the most important, like, kind of giveaways. But yeah, I think it's not that bad of a disease you can have, or a tumor that you can have. But hope this helps. Just remember the extra axial, man. Extra axial all the time, okay? Alright, thanks for watching. Peace.